Gout is a common form of inflammatory arthritis primarily affecting the joints, particularly the big toe. It occurs due to the buildup of uric acid crystals in the joints, causing intense pain, swelling, and redness. Understanding the causes of gout is crucial for effective prevention and management. 1. Excessive uric acid production. The primary cause of gout is the overproduction of uric acid in the body. Uric acid is a natural waste product formed when the body breaks down purines, substances found in certain foods and tissues. Normally, uric acid dissolves in the blood and is excreted through the kidneys and urine. However, when the body produces too much uric acid or the kidneys are unable to eliminate it effectively, uric acid levels rise, leading to gout. 2. Purine-rich diet. Consuming foods high in purines can contribute to gout. Purines are naturally occurring compounds found in various foods, including red meat, organ meats, seafood, and certain vegetables such as asparagus and mushrooms. When these foods are digested, they release purines into the bloodstream, which can increase uric acid production. 3. Obesity and metabolic syndrome. Obesity and metabolic syndrome, a cluster of conditions including high blood pressure, high cholesterol, and insulin resistance, are associated with an increased risk of gout. These conditions can disrupt uric acid metabolism, leading to elevated uric acid levels and gout development. 4. Dehydration. Insufficient fluid intake can also trigger gout attacks. When the body is dehydrated, urine production decreases, reducing uric acid excretion. This can lead to a buildup of uric acid in the blood and the formation of crystals in the joints. 5. Certain medical conditions. Certain medical conditions can increase the risk of gout, including kidney disease. Impaired kidney function can affect uric acid excretion, leading to elevated uric acid levels. Leukemia and lymphoma. These blood cancers can cause the rapid breakdown of cells, releasing large amounts of uric acid into the bloodstream. Psoriasis and other skin conditions. These conditions can increase cell turnover, leading to increased uric acid production. 6. Medications. Some medications, such as diuretics, water pills, and aspirin, can interfere with uric acid excretion and increase the risk of gout. 7. Genetics. Genetic factors can also play a role in gout development. Some individuals may have a genetic predisposition to producing more uric acid or having difficulty excreting it. Conclusion: gout is caused by a combination of factors, including excessive uric acid production, purine-rich diet, obesity, dehydration, certain medical conditions, and medications. Understanding these causes is essential for implementing effective preventive measures and managing gout effectively. By limiting purine intake, maintaining a healthy weight, staying hydrated, and consulting with a healthcare professional about medications and underlying medical conditions, individuals can reduce their risk of developing gout and manage the condition effectively.